Good evening again. My name is the Reverend Dr. Arlesia Simmons. I am the East Regional Associate Director with Partners in Health and Wholeness, an initiative of the North Carolina Council of Churches. We are excited that you took time out of your busy schedules to join us this evening as we observe Overdose Awareness Day and provide you more information about our new grant opportunity. For some of you, this will be an opportunity for the very first time to meet one of my new colleagues, Donna Parks Hill, who is the project coordinator of our overdose response and tobacco nicotine education program of Partners in Health and Wholeness. So again, thank you for joining us. You will notice that your mics will be muted until the Q&A time. Feel free to place your questions in our chat box or save them until the Q&A time. Also, if you should miss anything during our webinar, be assured that you will receive the link so that you can view it again, as well as any supporting documents and information you might need about our grant program. So again, we thank you for being with us this evening, and we would like to begin with a moment of prayer. If we could all center our hearts wherever you are, whether you are at home, in your dining room, in your living room, in your car, or whether you will watch this on the replay on YouTube. Let us center our hearts. Oh, holy God, we thank you for this day that you have made, and we thank you for life and health and strength. We thank you for protection and grace. We thank you for those things small and large. And we even thank you for the various challenges that sometimes we face. God, as North Carolinians, we thank you for your protection and how you watched us and kept us as the winds raged on. And God, we ask that you would look on those families across this land who were not as protected or safe from the winds and the waves of the storms, or those who were caught in the midst of the fires. Be their present help in this time of trouble. God, as we enter into this time of discussion, we ask that your spirit would guide us and that you would speak to us and speak through those your servants who will share information about a subject that sometimes we don't want to talk about in the church. God, as we approach this topic of overdose and substance use, it's not those people, but God, it's our family members, it's our friends, it's those we love and care about, and even those whose names we do not know. It's families from all spaces of life, the rich, the poor, the haves and the have nots. It's communities with cul-de-sacs as well as those in public housing. God, it is a problem and an issue that impacts all of us. And so, God, as people of faith, allow us to find ways to be your hands and your feet in this earth, to help, to protect, to save, and to help heal all who are impacted by an issue that we cannot escape from, no matter who we are, no matter what our titles are. God, help your people. Help us to do what it is that needs to be done so that those who need your assistance, who need help, who need us to be your hands and feet in the earth, who don't need our judgment, but they need the lifeline. We could be who you've called us to be. This is our prayer in the name of Jesus. Amen. Again, thank you for joining us tonight as we observe Overdose Awareness Day and we share information about our grant program as well as information about a congregation who is doing an amazing job. And so please pay attention and take lots of notes, but remember you'll receive this information in phase, possibly after the phase, so that you can share this with someone else. At this time, I'd like to introduce my colleague, Donna Parks Hill, who is new to PHW, but she may not be new to some of you. Thanks again for joining us.
Thank you, Dr. Simmons, for that warm welcome and beautiful prayer. And thank you all for everyone who's here with us tonight. We really appreciate it. And again, I'm Donna, and I'm the project coordinator for Overdose Response and Tobacco Nicotine Education with the Partners in Health and Wholeness Initiative. I just want to run through a few things real quick before we let Pastor Sarah speak about what her church and congregation are doing for their community. And we don't really want to assume that everyone here is familiar with our Partners in Health and Wholeness Initiative. So, and also I'm going to share some data and then some just general definitions before we get into the meat of it. So what do we do at Partners in Health and Wholeness? We work to bridge issues of faith, health, and justice. We empower communities to improve their health and well-being. We partner and support grassroots efforts to challenge injustice. So how do we do it? We provide resources, connections, and support to faith communities, for their health initiatives. We work to establish trust and partnership with faith communities and offer mini grants and community grants to financially support faith communities' health initiatives. Why do we do it? Well, we do it because we believe that all people are loved by God, that God cares about the wholeness of humanity and communities, mind, body, and spirit, and that our work and partnership with faith communities will improve health outcomes of people across the state. So this is a quick look at our agenda, what we'll be kind of reviewing tonight. And I'm going to start with a little bit of data just to kind of show you where we're at right now, in case you're not aware. This is data from the Department of Health and Human Services, North Carolina Department of Health and Human Services. This is from their opioid dashboard. And so this is where this data came from. And this is a trend from about 22 years of data here. So you can kind of see the trajectory and how overdose deaths really peaked in 2021. We may not have complete full data for 2022 yet, so that number is still it's still possible that may change once numbers continue to, or data continues to come in. So this one, that for the drug overdose deaths, this includes all drugs. So whether it's medications, illicit drugs, any of that, this is all drugs. And so in 2022, you can see that we had a rate of 36.9. That's per 100,000 people. That's so that we get a better kind of an understanding of where we're at. But it's raw data number of 3,875 deaths. And then the next slide is specifically illicit opioid overdose deaths. So out of all of the drug overdose deaths, this is the percentage of them that were illicit opioid deaths. And that was 79.4% of them were illicit opioid overdose deaths. And then this one is for drug overdose ED visits, and you can see how this is kind of peaked as well. The thing about this number is we can make different inferences here, but we try not to do that. So, we can say that higher emergency department visits may represent either or both increased total overdoses and positive reductions in overdose fatality, but we got to be cautious when we use inferences here. And then this last data slide, these county maps of North Carolina, the top one that's more kind of greenish blue, these are drug overdose deaths. And so the darker your county, the higher the rate of drug overdose deaths were. And then for the second map that's more blue, that is for drug overdose ED visits. And again, the darker the shade of your county, the higher that number was. And now I just want to give a few definitions so we can just make sure we're all on the same page. Again, I don't want to assume anybody knows something we're talking about and then not understand it. So when we're talking about an opioid, what is that? So according to the North Carolina Department of Health and Human Services, opioids are a class of drugs used to reduce pain. You see them given a lot in emergency rooms when somebody has an injury or surgery, things like that. They include prescription pain medication, but they can also include synthetic fentanyl and heroin. All opioids have a similar effect on the brain. They reduce the intensity of pain signals reach in the brain and affect the brain areas controlling emotion and breathing. So depending on how much you take and how you take them and your body, if your body has more opioids than it can handle, there can be very serious risk and side effects, including death. And there are some examples of some opioids listed there. And also, just one other thing I wanted to say about that is prescription medications have been a major driver of the opioid epidemic, but illicit drugs like heroin and the synthetic fentanyl are, as we know, increasingly contributing to this problem. And North Carolina and many other states are identifying fentanyl and opioid analogs and all kinds of other illicit drugs as well. So fentanyl is showing up in cocaine, methamphetamine, counterfeit pills, and all kinds of other drugs. So people using these substances may unknowingly be exposed to opioids and are at higher risk of opioid overdose from fentanyl and things that have that higher dosage in them. So using harm reduction techniques for safer use and having naloxone on hand can help prevent fatal overdose deaths. So speaking of harm reduction, we're going to talk about that for just a minute. And so at the very basic level, what is harm reduction? It's wearing a bicycle helmet when you're riding a bicycle. It's using sunscreen when you're in the sun. It's wearing a seatbelt when you're in the car. So at the very basic level, that's what harm reduction is. And when we talk about harm reduction, we do talk about it in a little bit different way. So see if we can go to the next slide. There it is. So when we talk about harm reduction and substance use or opioid use, reducing harm associated with high-risk behavior to improve quality life is harm reduction in any form. It includes many programs, policies, and practices. It's about dignity, compassion, and hope, and it saves lives. And I want to share a couple of quotes real quick from the North Carolina Harm Reduction Coalition. Treating every person, regardless of the circumstances or condition, with dignity and respect is harm reduction. Also, harm reduction emphasizes tolerance, respect for the personal choices of others, and respect for the human rights. It favors evidence over antidote, courage over cowardice, and doing what is right, even when it seems to send the wrong message. It means doing what has been done to protect the public health in the face of opposition from all quarters, because it is the right thing to do. And so the next harm reduction kind of thing we're going to talk about is naloxone. So what is naloxone? I know you've probably heard of it, but you may not know what it is, or also sometimes referred to the name brand Narcan. So it's non-addictive prescription medication that reverses an opiate or opioid overdose. You can administer via intramuscular injection or a nasal spray, and there's also an auto injector. It cannot be abused or cause overdose. So if you even think someone has overdosed, go ahead and use this if you have it, because if you don't have opioids in your system, it cannot harm you. It restores breathing and consciousness, or it can if someone's overdosed. And naloxone saves lives. That's just the bottom line. And so the last thing as far as harm reduction we're going to talk about is what is syringe service program. And you may or may not heard about this or know what it is, but It's been legal in North Carolina since July 7th, 2016. According to the CDC, individuals who participate in a syringe service program are 5 times more likely to enter treatment for substance use disorder and more likely to reduce or stop injecting when they use a syringe service program. And just to real quickly address some myths about what SSPs are not. So SSPs only give out needles. That's not true. They do give out clean syringes. However, it's so much more than that. It's about building trust and building relationships with folks and being able to refer them to medical care when they need it, whether it's treatment or vaccines or testing. And then, also just being able to provide them and connect them to resources when they need that. So SSPs, myth that SSPs do not enjoy broad, popular, and professional support, and that's not true. There are a lot of state, local, and faith-based organizations around the country already supporting SSPs. And as you can see to the right, that is Michelle Mathis. I don't know if she's on tonight, but if you don't know her, you need to. She's fantastic. She's the executive director of Olive Branch Ministry, and which is a faith-based harm reduction organization. And then SSPs increase injection drug use and undermine public safety, which again, this is a public health crisis. And actually, syringe service programs can decrease disease, infectious diseases, and also as far as public safety, make public safety more safe, because if someone's involved with a syringe service program, then they have a place to return their dirty needles, and they, instead of having them littered on the ground somewhere. So that's absolutely a myth. And so now I want to send it over to Pastor Sarah Howell Miller. She's a pastor of Green Street United Methodist Church, and their congregation is doing so many wonderful things around addressing the overdose epidemic and opioid crisis. And I want to give her some time to talk about what all they are doing. So I'll turn it over to Pastor Sarah.
Thank you, Donna. Thank you, everybody, for being here this evening. So I wanted to start just by telling y'all sort of how I got interested in harm reduction. So when we look at those statistics of overdoses and all of those numbers, we know that each one of those numbers represents a beloved family member, friend, acquaintance. Those are people in my life who are named Ian, Dylan, Denver, all these names. And like with so many people, my first experience with harm reduction came through a personal relationship. My spouse is a person with lived experience of substance use and overdose. And when we first met over a decade ago, he was in 12-step abstinence-based recovery. So I got most familiar with that approach to substance use, only to learn much later that that is one of many ways that people can seek recovery and stability in substance use. When I was first exposed to harm reduction, it was a couple years after that, and my spouse got involved with some underground syringe exchange that was happening in our area that had been happening for many decades, actually. And when I first was told that they were going to be giving sterile syringes to people who injected drugs, my first reaction was, why would you do that? That isn't that enabling. This is one of the first questions that folks who are unfamiliar with harm reduction often ask when they hear about this kind of work. And as with so many things, the more I watched and listened, the more I came to understand that this is actually really important work. This is life-saving work, liberative work, and it turned out it aligned really closely with my work as a faith leader. Early on in my education around harm reduction, I got connected with some folks who were working on spreading harm reduction education in North Carolina, and they actually sent me to an event in New York City called Shaping Sanctuary. And this was in the beginning of a faith and harm reduction movement. And I was so new, this was just overwhelming to me. I was in a room full of drug user union organizers and faith leaders who were promoting and supporting harm reduction. And I was overwhelmed, but I knew that I was in the midst of something really special. And so since then, I got really involved with Faith in Harm Reduction, which has recently become its own nonprofit. For a long time, it operated under the umbrella of the National Harm Reduction Coalition. And with them, I've been able to do some work on some webinars and developing some resources, some of which I can share with you all. I even went back to school for a master's in bioethics and wrote my thesis on harm reduction because I just got so interested in all the ways that this intersected with other justice movements that I felt passionate about. And one of the things oftentimes folks want to know, okay, what is the theology of harm reduction? How do you justify in scripture this kind of work? And one of the go-to verses that I have is from the Gospel of Matthew, chapter 15. And it starts that some folks are coming to Jesus and they ask, why do your disciples break the tradition of the elders? They don't wash their hands before they eat. And Jesus goes on and he kind of calls them out for some hypocrisy. And then he says, listen and understand. What goes into someone's mouth does not defile them, but what comes out of their mouth, that is what defiles them. So Jesus is trying to shift this paradigm, and for me, this image of what goes in versus what comes out. We have normalized in our society judging people for what they put in their bodies, but we've overlooked the fact that so often what is coming out of our mouths as individuals, as policymakers, even as faith communities, has been judgment and condemnation. And that is maybe more what we need to look at. One thing I came to see really clearly as I got deeper into harm reduction was there are so many things that we just associate with drug use. We say these are just the negative consequences of drug use. But often it turns out they are actually the negative consequences of the way we've structured drug policy, the way we've made life harder for people who use drugs through stigma, through putting up barriers to getting support, and through judgment. So Matthew 15, that's one that I go to a lot. I mentioned that my spouse had been involved in some underground syringe exchange, and when syringe service programs became legal in North Carolina, they took their operation above ground and they started operating out of Green Street United Methodist Church. I was not on staff at Green Street at the time, but Green Street had a long history of housing and being involved in a lot of different kinds of social services. To this day, there's a food pantry, clothing closet, all kinds of things. And for, I think, 35 plus years, the church has been home to the largest Narcotics Anonymous meeting in the city of Winston-Salem. And so there was already this profound commitment to people with experience of substance use, to people in recovery. And I love to lift up my church whenever people presume that there's a conflict between 12-step abstinence-based recovery and harm reduction, because we have both happening under our same roof and there is no conflict there. In fact, the last time I stopped in the syringe service program, I bumped into one of our liaisons from the NA group, and she was there getting fentanyl test strips for her nephew, who she knew was still using. So there's a mutuality there, a recognition that these groups operate on different parts of the same spectrum of care and compassion. Several years after Twin City Harm Reduction Collective started at Green Street, I became the pastor there. And it was a shift for me, has been a shift for me in recent years, where I had worked part-time with Faith in Harm Reduction and was doing a lot of sort of national level advocacy. And now I got to be part of what was happening on the ground and try to figure out what that might look like. And we had done a couple things here and there, and then this mini grant from PHW came up, and I thought this seemed like the perfect opportunity to do something a little more tangible. And so we initially got a small grant, and with it we purchased naloxone, so just the small vials of naloxone. I have a friend who refers to the vials of naloxone as God in a bottle, because they basically bring people back from the dead. So we purchased 600 something vials of naloxone. We got the intermuscular syringes and other needed items from Twin City Harm Reduction Collective. And one Sunday, we just covered our altar with those vials of naloxone, and we took a moment in worship to briefly talk about the overdose crisis, to bless the naloxone collectively, And we took a moment, as we're going to do later in this webinar, to lift up the names of people we've loved who've been lost to overdose. And that was a powerful moment in the service because, again, every one of those data points is a name and a beloved child of God. And the following Sunday during our Sunday school hour, we invited folks to come back to first get some harm reduction 101 education, to talk some about what harm reduction is and why we should care about it as people of faith. And then our folks together assembled these overdose response kits that then we were able to give directly to Twin City Harm Reduction Collective so they could offer it to the folks who are really on the front lines of the opioid crisis, which is people who use drugs themselves. We were fortunate that PHW offered us a supplemental grant, a little more money. So we actually just yesterday got more naloxone in the mail. And I'm excited about this because what I'm hoping to do is to rope in some of my colleagues locally. I've had conversations with our local rabbi, has been in his position for I think a year and has already done multiple funerals of young people who have died of overdose. Also, we have a new Unitarian Universalist minister who I had actually met through Faith and Harm Reduction work, who has just come to town and has some familiarity with that work. And so I'm hoping that we can spread the gospel of harm reduction, which to me is a gospel of compassion and care and justice for the least of these. So I know I technically have until 7:30 to talk, but there are always great questions that lead me to say more. So if it's okay with Donna, I think I'm going to stop talking and we can go to the Q&A.
Thank you so much, Pastor Sarah. Yes, we will go ahead and open it up now for questions.
And I think you can either speak up or put it in the chat. I'll do my best with either.
And let's see, I'll go ahead and start with the chat.
Yeah, so I see one. How do you counsel pastors who are afraid to carry Narcan or keep it in their sanctuary? Yeah, so and honestly, this is actually true of anything that people are hesitant about in regards to harm reduction, is I would start by asking why. Where does that fear come from? Get curious about where people are coming from. And because I don't know what the reasons are. Sometimes it's a lack of understanding. I am often surprised by how many people think that Narcan is itself an opioid. And of course, if that were true, I would also be very concerned about carrying it or keeping it in my sanctuary. So sometimes there is just some education or simple answering of questions that needs to happen. If there are deeper issues of, well, I'm sort of speculating at this point, but it does make me wonder whether there is a sense of, if we keep this here, will people come who are using drugs? And my challenge to that would be that there are already people who use drugs in your midst. You may not know it. They may not look like you think that they would. And that reminds me of, I have a pastor friend who, her church was doing much of the same thing that we did, of assembling overdose response kits. And then they were sending them out to organizations out in the city. And they realized they hadn't kept any at the church because they just assumed that no one would ever need them there because none of their people use opioids. Well, they realized that just wasn't true and that there was a fundamental flaw in that assumption. And so they made a point in the future to make sure that I encourage every church to keep naloxone in their first aid kits. Right before the pandemic, I got to go hear our Surgeon General speak at the local medical school. And it was mostly med students. He asked the whole room, how many of you know CPR? And everybody raised their hand. And then he asked, how many of you carry naloxone? And myself and maybe 3 other people raised our hands. And he told us, you are more likely to need to use naloxone than you are to need to use CPR. So it really is something that can save a life, that doesn't have any other harms or side effects. So again, start with curiosity, but those are just some potential offerings. I see one question.
Sarah,
Is there a higher? Yeah.
This is Arlisha again, and
Hi.
I don't mean to interrupt, but I wanted to share, just a couple of weeks ago, I was leaving out of my apartment and it was about 7:30 in the morning, and I had to use some that I had taken from one of our clergy breakfasts because there was a young man in the parking lot who was passed out. And thankfully, on that morning, there was someone who was coming from Moore County who was an EMT. So I'll write about this in a couple of weeks, you'll read it. But I say somebody had been praying for him overnight because the fact that you had an EMT getting off work and then someone who, when she said, "Well, I don't want to touch him until they come." I said, "Well, I'm a clergy person. I have the Narcan." We called 911 and we were able to administer that to him. I live in Fayetteville. I live around those who are in the military, college students, and so no matter where you are, you don't know when someone who is your neighbor, and it may not be someone you know, but this was an absolute stranger passed out in the middle of the street, 7 o'clock in the morning, a Saturday morning. And so if I did not have that, and it took a while because she was counting down how long the EMTs were, took to get here. We have a fire department, but it took them roughly 20 minutes to arrive. And so 911 said, go ahead and administer it. So you never know. And so when people think, people will suspect you of something because you're carrying it around, you never know. It may be in the grocery store parking lot that you may have to use it because someone has driven there and passed.
Absolutely. Thank you, Arlisha. That is a great story and example. I'm glad you were there to help out. I see a question about if there's a high rate of ODs in our area. I mean, there is pretty much everywhere right now. I don't actually know the specific statistics, but one of the beautiful things about having a certain service program in our building, since they give out naloxone, when folks come, they can ask them, have you used any naloxone? Have you had to reverse an overdose? So they're able to get kind of a rough count of about how many lives have been saved with the naloxone they distribute, which is a pretty powerful statistic to have. This is a good question I may not have a great answer to, but how have you ministered to the children in your congregation whose lives have been affected by overdose? Sadly, most of the cases in my congregation have been people's children, often young adult children. So I have not personally had much experience ministering to children, perhaps whose parents had overdosed, but maybe while I heard something on the radio a while ago that pointed to some really good resources for how to talk to kids about substance use, addiction, and overdose in a developmentally appropriate way. So I might do a little Googling on my phone when my turn is over and put that in the chat if I can find it. A question about, oh, sorry.
Sorry, I see someone has their hand raised. Kimberly,
Okay.
did I say your name correctly?
Yes, you did. There's an A there instead of a Y. I have a two-part question. I pastor a relatively small church, the AME Zion Church in Harnett County, in a small town called Coates. Population maybe 2,380. I was curious as to how Pastor Miller, you went about making the community aware of the fact that you were able to offer those services. We do a monthly food giveaway on the fourth Sunday, and one of the members said to me, "Oh, you see the guy walking down the street? They just had to revive him from an overdose." And it was just kind of like, you know, it was just eye-opening to me, really. It really was. But how do you go about, or how did you go about getting that information out in the community? And secondly, what are the regulations with regards to housing the needles, housing those things?
You mean like keeping them at the church?
Yes.
Okay, so I'll take the first one first, and you're asking about how getting the word out to people who might need these services. Is that what you're
Yes, to
asking?
the community at large.
Sure,
My mind is rolling. I'm thinking about the schools, the high schools,
sure.
um, the police station, making them aware. They would probably be a good resource. So
Yes.
I just wanted to hear
Yes.
your
So
thoughts.
one thing I'll note is Twin City Harm Reduction Collective is their own 501c3, their own nonprofit that we partner with. So we, do what we can to support their programming, but they take the lead on that kind of thing. So they do, but I know that they do a lot of different things. So they already had some existing relationships with folks from the underground exchange. It took a long time for people to start to trust that it was actually legal for them to be distributing syringes, because for so long it was illegal and you could be charged with paraphernalia, all of this. They do a lot of outreach to folks who are unhoused. They work really closely with other nonprofits that work with people who are unhoused or who have substance use issues. They have strong relationships with the hospital, with the infectious disease unit there. They do
Mhm.
work with the police and sheriff's department. I've worked with them really closely. So the short answer is a sort of a long one, that many community relationships are vital to the success of a program like this. And, as a church, we do what we can to support, because there's always going to be pushback as well. There will always be folks who don't understand what's happening, who have fear, who just aren't able to get there in terms of support. And so part of our role as the church has been to just provide them some cover and to say we support their work and, offer to work with folks if there are any issues that come up. So it's a many layered process. The question about housing syringes, there's no issue with that. It's not, there's no legal issues. Everything that they distribute is covered under our law. For individuals who receive these services, the law requires them to be a participant in a syringe service program. So they have membership cards that they give out to their folks, so that if they are arrested for any reason or stopped for any reason, they should not get charged for paraphernalia and for residual amounts of drugs. So I don't know if that
Okay.
answered the question.
Yes, thank you so much.
Yeah. I saw a question about if naloxone is something that people need to be trained to use or it's just passed out. Training is always great. There are right and wrong ways to use naloxone. One of the big ones is that if you have ever seen the movie Pulp Fiction, they looks like they inject it right into somebody's sternum, and that is not how you use naloxone. So training is always good. The kits that we assemble and have given to TCHRC, they come with instructions in them. But like the nasal spray is pretty self-explanatory, but training is always good. Instructions are always good. But thankfully, since it is a relatively safe medication, it's not super vital.
And I'll just add to that, if you're looking for someone to come do a training for you and your congregation, harm reduction coalitions in your area or harm reduction organizations. Also, there's usually someone at the health department that can do it, depending on what kind of programming they have. And if it comes down to it and you can't find anybody, reach out to me. I'll be glad to do one for you.
Awesome. Thanks, Donna. Yeah, and I would just say in general, if you're interested in doing this kind of work, the first step is to figure out what's already happening in your area and see how you can support and partner. And that health departments, nonprofits, etc.
And to add to that, somebody says, where would you go to get naloxone? Same places I just mentioned, health department, harm reduction organizations and coalitions, places like that. And if you can't find a place in your area, again, reach out to me and I'll help you find a place where you can get it.
They did just make the nasal spray over the counter. So you can get it at pharmacies. It tends to be expensive. And, but like at TCHRC, they're happy to give it to anyone, but they want to prioritize giving it to folks who are likely to be around. As Arlisha shared, you never know, right? But folks who are regularly in contact with people who use opioids are the folks who are really important to make sure that they have that on hand. Um, On a bigger picture level, what resources would you suggest for faith leaders who never really got any training in school on addiction and ways to minister to users and their loved ones? I relate to that. I didn't get any of that either. I learned through trial and error. Absolutely. I think starting by just listening to the stories of people who have the lived experience, that was what was most transformative for me. I can recommend a couple of books that I think that have been helpful for me. I've got a friend I need to make write a book about faith and harm reduction, but there are books out there that can be helpful just to understanding addiction and harm reduction broadly. But I do think that just a general approach of curiosity and listening is the most important thing. I've learned there just is no one way for someone to go through an experience of substance use and addiction. And so there are things that we can learn, that we can keep in mind and bear in mind. But as a minister, meeting people where they are and trying to understand and love them as people is kind of the first most important step. Lindsay's doing a naloxone training for church staff alongside first aid, AED, and CPR trainings. Keep it in the church first aid kits. That is awesome. We're working on doing the same at our church. We just got an AED, so we are thinking of this broadly and thinking about community safety in our congregation. And overdose response is just one of many things that it's good for us to be prepared for in our congregation. Do you have individuals show up to Green Street United Methodist Church that you've had to administer Narcan to? If so, how many people? There was one instance where a person was overdosing and they were in a car, they weren't actually at the church, but the person driving realized that they were closer to the church than to the hospital and decided to come by. It was actually not a good day for them to come by. The TCHRC was not open. My spouse and I happened to be there. I don't even remember why we were there. And so he was able to respond and administer naloxone right there in that moment. I think there's sometimes a perception that if you have this kind of program at your church, then you're just like responding to overdoses constantly. That has not been our experience. But that's the one case where I can think of definitely that someone showed up in that state. Not that there haven't been other incidents, but it's not. Yes, yeah, it's a lot. We've definitely had neighbors whose perception is that there are people just nodding out and overdosing everywhere, and it's just not the case. Many of the folks who come in, you couldn't tell who's coming to the Stern Service program and who's coming into the office for work. So.
And we have we have some more presentation for you. So there's two questions at the very top that I'm going to go back to real quick, and then we can move on. Somebody made some good recommendations for some Netflix and Hulu documentaries, I'm sorry. So did the ED visits result in death, or were they just OD visits? So the data on the ED visits were just overdose ED visits. They didn't count in the death data was separate. And then someone says, Phyllis says, where is that found? You probably wrote that while I was presenting, or one of us was presenting. Can you come off mute and let us know what the question that's referring to?
Yes, that was referring to the naloxone. Am I saying that right?
Naloxone.
Yeah, that was referring to that. So it's been answered.
Okay.
Thank you.
Okay. Sure. And then, okay. Oh, Sarah shared something there. So, if you have further questions, please, you can reach out to us afterwards, but we want to make sure that we get all the information to you we can in this small time period. So I'm going to turn it over to Stephanie. Pastor Sarah, thank you so much for all of that.
Good evening, everybody. My name is Stephanie Sanders, and I am the Program and Engagement Administrator for Partners in Health and Wholeness. And as we shared in our advertisement for this event, not only are we here to bring awareness to the overdose crisis, but we also want to make you aware that PHW has grant funding available for faith communities who are interested in doing work in this area. And I just want to do, it's going to have to be quicker than we thought. Just a quick overview of how you can go about applying for this funding in this area. So the first step to becoming eligible to apply for a grant is to join the PHW Collaborative. And you can do that by going to our website, healthandwholeness.org. It's right at the very top. I can't miss it. Once your collaborative pledge is approved, we will send you a link to apply for the grant, and then we will review the grant and we'll let you know where that goes. That's just the very bare bones description of it. And we promise this won't be a memory test. It's all on our website. We'll send it all out at the end of this. The reason we ask you to submit a collaborative pledge first before applying for a grant is so that we can get to know you as a faith community, and not just as not just in according to the work that you want to do in overdose response, but in other areas of health as well. So the collaborative pledge really helps us get to know you and to know how to help you in a broader sense. The collaborative is open to any worshiping faith community that meets regularly in the state of North Carolina. And all you need to do to apply is go to healthandwholeness.org/collaborative. The URL is down there at the bottom. If someone can drop that in the chat for me too, that would be great. There are a few details that I've listed here that you can also find on our website about how to get started. Regarding the grant eligibility itself, there are a few stipulations that I want to make you aware of, which is that you have to be an active member of the PHW Collaborative to be eligible to apply for a grant. And that means that you have a collaborative pledge on file with us within the last 12 months. The other thing is that if you've already received a grant in 2023 of any kind, unfortunately, you would not be eligible to receive this grant in this upcoming cycle that we have that's running through November 30th. Again, to apply for a grant, you will get a link in your collaborative pledge acceptance email to apply, and you will have through November 30th to submit an application. Let me also say that if you do not have a collaborative pledge on file yet, you will need to submit your collaborative pledge by November 16th in order for us to process it in time for you to apply by the 30th. So collaborative pledge, November 16th, mini grant, November 30th. Those are the deadlines. A few things to be aware of when you are applying for a grant. You might want to kind of work to the side and fill out like a Word document with your answers and have that ready before you go into the form, because you have to complete it in one sitting. You can't come back and save your work. So you might want to have that in more than one place when you're working on it. You'll receive an automated confirmation email from us when we receive the form. That doesn't mean your grant has been approved. That just means we have received it. As far as the timing of grant awards, this is going to be a little bit different if you're used to applying for grants with us. We're going to be doing it a little bit differently now. We're going to be making awards in 2 rounds. The grant cycle is currently open. We are accepting applications now. The first decision will be made in on September 30th, on or before September 30th, or excuse me, on or after September 30th. And so anybody who applies in round 1, if for some reason we aren't able to approve you in round 1, you will be eligible to reapply again for the second round. And then For round two, we'll be making decisions on or after November 30th. And the notifications about your grant application will be sent on or after these dates. I already said that you can reapply. Grant funding is competitive. If every person on this call were to apply for a grant, we unfortunately would not be able to give it to everybody. So in order for a successful grant to be submitted, we need as much detail from you as possible. A timeline, a budget, why you think your community is in need of this type of funding. We want to know what you hope to see come of your project with the outcomes. And we recognize that many of you are brand new to this work and might not know where to start. And so with that in mind, we have created a project menu for you to kind of spark some ideas about what you could possibly do. And Donna's going to go through that with you a little bit now.
Yes, so these are just some ideas that of things that you can apply for the opioid mini grant. If you have other ideas, you're welcome to contact me and share those with me to make sure it's something that makes sense to apply for. But these are just a few of them. So a town hall meeting or forum around harm reduction, the opioid settlement funds in your community, the Good Samaritan law, which goes along with administering Narcan or naloxone, and other things as well. A medication take back day to promote awareness of medication disposal boxes in your community, as well as distribution of lock boxes to lock medications up in, and or medication disposal kits so that you can dispose of them at home properly. Some other things are holding naloxone trainings and doing a naloxone distribution. You can do, even with that, a naloxone packing event, a supply drive for your local syringe service program or harm reduction program. You can start a book or a study group, a book club or a study group, so you can possibly purchase some books or some study guides around this topic to be able to have those studies or clubs. And then lastly, another example would be to have host recovery groups in your congregation or at your faith community. AA, NA, Al-Anon, Mara, Celebrate Recovery. There's a lot of different ones that you could use and spend a little bit of that money to be able to host them, as far as having refreshments and food available and purchasing materials and things like that. So that's just a quick little overview of some examples. And so if you have specific questions about that, you can contact me if you have specific questions about how to apply, or about the collaborative process. Reach out to Stephanie, and her information is here on the screen. And lastly, I wanted to mention that I can also, and this is separate from applying for mini grants, but I can offer to you workshops. So one is around the opioid crisis, overdose awareness, those type of things, things that you can do, data, speakers. So a whole workshop around the opioid crisis. I can offer that to your congregation, to your clergy in your community, to your community members, however that needs to look for your congregation and your community. I'll also be doing those for tobacco and nicotine education as well, and that's separate. And you don't have to pay for those, and you can have both of them if you want to on separate dates. So I just want to mention that real quick as well, and you can reach out to me for more information about those. And we have almost come to the end, so I'm going to hand it back over to Pastor Sarah.
Thank you, Donna, and thank you, everybody, for being here and being part of it. So to close us out, it is International Overdose Awareness Day today, August 31st. And so I wanted us to just take a moment to acknowledge that. I'm going to lead us through a brief naming ritual, And the prayer that I'm going to use, as well as the benediction, are both going to be adapted from that Spirit of Harm Reduction toolkit that I placed the link to in the comments earlier. There are a lot, maybe even too many resources in there. We're actually working on some smaller, more accessible resources, and I'll actually put the link to Faith and Harm Reduction, our own website, in there as well. But we're going to take just a minute, and I've mentioned a couple times putting names to those data points. And so I'm going to begin by starting to read a blessing, and then we'll pause. At one point, I will invite you to lift up names of people lost to overdose. And you are welcome to come off mute and speak the name, to put it in the chat. Because there continues to be a great deal of stigma about overdose, maybe just be mindful of that person's privacy, and if they might not want their first and last name shared in this kind of setting, consider just using a first name or initials. So I'm going to invite us to just start by taking a deep breath in and release. Let's join in this blessing. My love, my sibling, my parent, my friend, you are family to me. And your perfection is not required. It never was. Not to love you, not to grieve you. You are and always have been worthy. We know the truth of you, your love, your contradictions, your challenge. We know your laughter and hurt and hope. And we carry you with us even now. So today we call you by your name. I invite you to speak or write in the chat any names you'd like to lift up.
Bobby,
My brother Curtis, Pastor DB,
Zachary Middleton,
Johnny,
Boys, BJ, Veronica,
Anika,
Elder Juwan Taylor,
South Dorm of Community, Durham, North Carolina.
Amen. And we acknowledge there's space for many names that we don't know or aren't able to speak. And today we call all these people by one name, and it is beloved. Today we allow ourselves to love them fully, to grieve them honestly, to acknowledge that their lives were lives worth saving, no matter their choices or their struggle. And we know this because grief is born of knowing. We pray that these memories would be a flame for the way forward, compelling us to act as agents of resurrection, proclaiming loudly that every life is worth saving and all loss is worthy of our grief. Amen. Thank you all, and I will send us with this benediction. May God bless and keep us, especially those who have been wounded by an epidemic of silence and inaction, who can't breathe, smothered by stigma and shame, whose communities of faith have yet to bring them an expansive grace. May God allow God's face to shine upon us, on those on the front lines, persistently, consistently proclaiming worth and love, and especially on those here with us because they are perceived to be other, hard to organize or work with. May God lift us up so that God's gracious and abundant mercy would fall upon all of us, so that we might be lifted up into hope that fosters justice and healing. And God grant us peace, the peace which passes understanding, a peace offered in liberation and in love. Amen.